Hello, my name is John Hibbs. I'm currently a master's student at USF in the Library and Information Science program, and I've also worked and volunteered at several schools throughout the Pasco County School District. I'm here today to talk about the COVID-19 pandemic and experiences and lessons I've had with the pandemic, both on a micro and macro scale, as a young adult who is severely immunocompromised. Before I talk about COVID-19 and my topic as a whole, I want to sort of give you a little bit of background about myself and what led me to being immunocompromised. So, slightly over a decade ago, at the end of my time in middle school, I started feeling intense discomfort in my intestines, cramps, weight loss, and all of these symptoms led me to going to a gastroenterologist, where through a battery of tests, colonoscopies, etc., we determined that I had Crohn's disease, which is an autoimmune disease where your immune system attacks different portions of your intestines. Through many different treatments, drugs, steroids, and eventually surgeries, we eventually were able to settle upon a treatment plan that really worked to help get my Crohn's disease under control, which was called Remicade. It's an infusion I get every 8 weeks from a doctor's office where I go in and I get an IV put in, and for a couple of hours I sit there and get infused with this drug called Remicade. Remicade is an immunosuppressant, so it sort of generally suppresses my immune system, which does lower the damage that my immune system causes to my intestine, but has the side effect, of course, of suppressing my immune system. So I'm very vulnerable to different viruses and bacteria just on a normal general basis, which had implications before the COVID-19 pandemic. So I've always had to get my flu shot. I've always had to be aware about being around people who are ill with viruses or bacteria, and I've always needed to practice very sufficient personal hygiene and just general, preventative methods to getting sick, because I have a compromised immune system and I'm not quite as capable of fighting off ailments as the normal 24-year-old young man. So now I want to sort of dive into COVID-19 and really start with my experiences with the virus and sort of give a sort of very brief timeline of how I've experienced the virus from a sort of first-hand perspective. So I first heard of COVID-19 back in about November, December of 2019. And at the time, it was just sort of a distant virus off in rural China that was sort of concerning, but it wasn't yet a part of my life. And I sort of just dismissed it like most people did. But several months went on, and it started becoming an increasing part of the news cycle. And eventually, around February, I really started, February of 2020, I really started to do research and really look into the virus. And I sort of realized very slowly, and then all of a sudden, that this was going to be a massive worldwide event, that this was going to be a pandemic that really reached every part of the globe, and obviously Florida, which is where I live. And so from that time on, right around the end of February, early March, I entered full lockdown. And for almost an entire year, slightly over an entire year, I have been in full lockdown, and I haven't left my house except to go to certain doctor's appointments, medical procedures. So I haven't seen friends, I haven't seen extended family, I haven't left the house to go to the university campus or to go to the grocery store, or really anywhere for an entire year. And this has obviously had many effects upon my life. So now I sort of want to talk about experiences on a personal level and lessons that I've learned from the COVID-19 pandemic. So I've really had three main struggles with COVID-19, and those are being fear, anxiety, and just general boredom. First off, fear and anxiety have been a constant part of my experience with COVID-19. Whenever anyone comes to the house, whenever I'm around anyone at the doctor's office or at a medical procedure, I'm always very concerned and very aware that anyone around me could have the virus, or that any surface, or that any sort of just experience or presence outside of my very small bubble that I've created for myself in my own home could produce risks of me getting the virus and getting extremely ill because of my immunocompromised status. So living with that anxiety is something that has really been a constant sort of waxing and waning problem for me throughout the entire pandemic, and has really sort of left an indelible mark on my psyche. And beyond just sort of general fear and anxiety, quite frankly, I've experienced very tremendous boredom. After a while, There's only so many books you can read, only so many podcasts you can listen to, only so many classwork assignments and video games that you can play before you really begin to miss the outside world, before you begin to miss your friends, before you miss going to restaurants and bars and meeting up with friends and just doing all of the general things that one would do, what a normal young adult would do over the course of a year. So these sort of struggles have really played a constant part in my life over the last year and have sort of waxed and waned in terms of how much they've really just sort of affected me. And I think I've reached a point at this point in the pandemic, as the vaccines sort of start rolling out and as normalcy starts to sort of return, that these problems have sort of really started to lessen their impact. But particularly the fear and anxiety and worry and germophobia will definitely stick with me beyond the sort of return to normalcy after the pandemic. COVID-19 will also sort of permanently impact how I behave, sort of general behavior that I have once I go back into the real world, once I've been vaccinated. A lot of the precautions that we've begun to take to prevent the spread of COVID-19 are just sort of things that I think very logically will become part of my life. So things like wearing masks, social distancing, being very aware of personal hygiene, hand washing, and sort of being very aware of where I cough, where I sneeze, where other people cough, where they sneeze, etc., etc. These will all be things that persist with me after the pandemic has come to a close. I think as someone who is very severely immunocompromised, I think it's very logical to, within reason, try to wear masks and continue social distancing after the pandemic. I obviously would get very sick from COVID-19, but really any virus, any bacteria that I get infected with could be very severe for my long-term health. So I think that one thing that will stick with me after COVID-19 is that all of these precautions that we've took to really help play our part in preventing the spread of the virus are sort of things that really will stick in my behavior patterns after the virus is sort of part of history. Finally, in this last part of my talk, I want to go into what you as the audience can learn, what actions you as the audience can take to really help your community, to help your family, to help your friends sort of heal and recover from this pandemic that has been possibly the most traumatic event on a grand societal, on a grand world scale that we've really experienced in many, many decades. So what I really preach, the solution that I really want to preach to everyone is that we need to be ready to practice empathy, to understand that the struggles that I've had, the struggles that you've had, the boredom, the anxiety, the fear, the just general just grief that we've all felt at this pandemic is something that everyone, almost everyone in society, everyone in our friend groups, everyone in our family groups are experiencing. I do not know a single person who doesn't know someone who has either died or gotten severely sick or is currently in the hospital. Everyone in society has been in some way personally touched by this pandemic, and we need to be aware of that, and we need to be empathetic, and we need to be ready to reach out to our friends, to reach out to acquaintances, to reach out to coworkers, to everyone in our lives, and practice radical empathy. We are not isolated people. We are all part of a society, and I think the most effective tool that we have as members of a society, as members of a community, as members of a friend group, as a family group, is our empathy, is our ability to see that we've experienced struggle and understand that everyone else in our groups have experienced these struggles. We've all experienced human loss. We've all experienced the struggle of personal isolation. We've all experienced economic hardship. And so if we're able to reach out to others, if we're able to lend them an ear, lend them aid, lend them material aid, lend them just a helpful hand. These are sort of steps that we can take as individuals to really start the process of healing for ourselves and for the people in our lives. I really, really, really preach that we're just very understanding, that we are willing to view other people as experiencing the same things that we've experienced during this pandemic, and that we're willing to really go outside of our comfort zones, to go outside of our normal day-to-day behavior, and really just reach out a hand to our fellow human beings. And I know that this may seem like a very simple solution, and I'm not here to really discuss grander solutions, healthcare solutions, health policy solutions to prevent further pandemics, but really all I'm here today to discuss is that we, as individuals, can really indelibly impact the lives of our friends, of our family, of our community members by just being empathetic human beings. And so to sort of wrap up, that is what I really want to impart to the audience. I really want you, as an audience member, to reach out to someone in your life and just give them a helpful ear. Give them physical help, give them emotional help, give them material help, and really just slowly help the world, the community, our state, our country to heal. Thank you.